Hello, my name is Gerry Ross, and I want to invite you to a PBM/low-level laser course that I'll be giving on Saturday, February 13th, along with Drs. Mel Birchman and Aaron Darbar. I've been using PBM since 1993, and I've found it to be an invaluable tool. In fact, I use it daily in almost all facets of my dental practice. I found it to be a win-win. From a patient perspective, it has proven to be a huge practice builder based on the positive effect that my patients have seen. I'll briefly cover a few of the many applications we'll be covering in our course. A huge one is the reduction of post-op pain after extractions and surgery. In the last 10 years, I've stopped writing pain prescriptions for opioids. And with the spotlight in opioid overdoses, this is huge. Another application is the treatment of TMD and facial pain. Over the last 30 years, I spent a lot of my practice time treating these conditions on a referral basis. Many of these patients have been seen by other practitioners who failed to help them. Using PBM as a major part of the treatment, and without the use of any pharmaceuticals, I have enjoyed a 95% success rate. Lastly, I use PBM for analgesia, and in many cases, this has allowed me to deliver needle-free restorative treatment. This has been especially huge in the treatment of children. There are two keys to successful treatment. First is the application of the correct dosage. Secondly, is the application is done at the correct points. In our course, you'll learn both, so you'll leave feeling competent and confident to take this to your practice and successfully begin treating your patients immediately. I can guarantee that this course will change your practice for the better. We look forward to sharing our 75 years of clinical PBM experience with you.